Meeting is being recorded.
So good morning, everyone, and welcome to today's Talk with a Doc, all about fitness for longevity with Dr. Shazaan Hushmendy of Mount Sinai, South Nassau. My name is Brooke Oliveri. I'm the manager of the Long Island Health Collaborative. And for those of you who may not know, the collaborative is overseen by the Nassau Suffolk Hospital Council. And the council is a coalition of 300 plus hospitals, county health departments, community-based organizations, and organizations from really all sectors that are all invested in improving the health of Long Islanders. So many thanks to our sponsor, AARP New York, and of course to Dr. Hushmendy of Mount Sinai, South Nassau for taking the time out of his busy day to educate us about fitness for longevity. Some housekeeping. Luckily for those who couldn't make it to join us live this morning, the program is being recorded, and by participating, you are consenting to being part of that recording. We will have some poll questions before and after today's presentation, and we will have an interactive Q&A session with Dr. Hushmendy. So please feel free to put your questions in the chat during the presentation, and we will certainly get to all of those questions at the end. So now I would like to introduce Ronnie Avnet, a AARP volunteer and virtual ambassador, to say a few words about AARP.
Hi, good morning, everybody. Wait till you hear where the doctor's from. My name is Ronnie Avnet Stoll, and I'm an AARP Long Island volunteer. On behalf of AARP, welcome to today's Health Talk with the doctor in a webinar. We're committed to helping you stay healthy and stay connected. So we congratulate you for taking the time to learn more with AARP and the Long Island Health Collaborative. AARP, as you know, is a nonprofit, nonpartisan membership organization for people age 50 and older. There are 38 million members nationally, approximately 2.5 million in New York State, and about 500,000 living on Long Island. AARP works to strengthen age-friendly communities and make for happier, healthier residents of all ages. And we advocate for what matters most to people 50 and over and their families with a focus on health, security, financial stability, and personal fulfillment. Learn more about AARP, online classes, events, local discounts, volunteer opportunities, and more at aarp.org/near-you. Thank you so much for coming, and let's meet the doctor.
Thank you so much, Ronnie. And once again, thank you, AARP, for supporting our Talk with a Doc, Walk with a Doc series this year. Before our highly anticipated presentation, we do just have a few pre-event poll questions for you to answer, if you wouldn't mind taking a moment to do so. Feedback on these questions, it allows us to better tailor our future programming, and it also gives us a sense of your impressions before and after the program to gauge knowledge learned, etc. And you might be thinking, some of these questions, one of them is, I am informed about today's topic. You might not be sure yet, but that's why we're trying to gauge your impressions before and after. So we really appreciate any feedback. So thank you. I'll just give it another maybe 20, 30 seconds here to allow everyone to respond. I see responses coming in. Thank you all so much. Okay, I think 15 more seconds and I will close out the poll. Okay, great. Thank you all so much for your feedback. We really appreciate that. Okay. So now I would like to introduce Dr. Shazaan Hushmendy. Dr. Hushmendy's expertise includes anterior total hip replacements, minimally invasive total knee replacements, partial knee replacements, plenty of other orthopedic procedures. And he is from Mount Sinai South Nassau Hospital, where he is the Chief of Joint Replacement Services. And now I would like to hand it over to Dr. Hushmendy.
Thank you so much, Brooke, and thank you, Ronnie, as well. I see a familiar face here. Meryl, nice to see you. So I am actually, I'm in Iceland right now on a family vacation. So if you guys having anything sort of disruption of the Wi-Fi here, just let me know. So I apologize for the attire I'm wearing, and I apologize for any sort of technical complications that may arise. So as a doctor, and we can go to the next slide. So as a doctor, I often emphasize the importance of exercising. If anybody's ever had a surgery by me, or even before surgery, I do emphasize stretching to improve, the longevity of the patient's not only implant, but their health. So today I would like to share some valuable insights on how exercise can positively impact your health as we get younger. We can go to the next slide as well. So this is just a brief breakdown. Honestly, my presentation is only a few slides. I know it looks a little more intense than it really is. But aging truly is a very natural process. And in this presentation, I'm just going to explore a few of those different concepts of what we should try to do on a daily basis and what we should try to accomplish in a weekly basis as we are growing together. Brooke, next slide, please. Unless I can, Brooke, can I control it, or is it more?
I am advancing them, so if you would just please tell me when to advance.
Okay, absolutely. I just feel really
perfect.
bad to keep saying that. I
No,
apologize.
it's great. Thank you.
So benefits of exercising on aging. So regular exercising has actually been shown to improve immune function. So reducing the risk of infections, boosting your overall health. It actually has been shown to help with better sleep quality, which is actually essential for cognitive function, mood regulation, and overall health being. Now, studies have actually demonstrated that physical activity can lower the risk of developing conditions such as dementia and Alzheimer's, kind of related back to the first two things that I was talking about. And then also engaging in any sort of exercises. I think we've all been to the point where we do a little exercise and we get like really happy for the next, 3, 4, 5 hours. We are releasing endorphins. These are like natural brain chemicals that are helping us enhance our mood, helping reduce depression, help with anxiety, and they stabilize our mood. And not only with that, exercising reduces chronic conditions, chronic diseases such as diabetes, osteoporosis. You can go to the next slide as well, Brooke. Thank you. So the types of exercises, and I'm going to spend a little time on this slide here. So there are different types of exercises. We have aerobic exercises, which is like I write here, walking, jogging, swimming, cycling. Now, these can be incorporated in our daily sort of routine. They provide tremendous health benefits, primarily for your cardiovascular system. Now, research, particularly for this type of exercise, shows that it does improve in brain sort of strength and quality. It increases the size of your hippocampus. The hippocampus is this tiny little region in our brain that is very important for memory and learning. So the more stuff we do to help with the heart and lungs, it actually helps with our brain function. Now, the second type of exercising is strength training exercising. And we talk about weightlifting, resistant bands training, and these are crucial for building muscle mass. They say that after the age of around 25 and 30, our muscle mass, our bone quality starts to decline. So that is our peak, and then we're going downhill from that. So not only does weight training help increase muscle mass, it helps maintain our bone density. And as we all know in this room, that bone density is crucial for things such as preventing and reducing the risk for osteoporosis and reducing the risk for fragility fractures, hip fractures, etc. The next step of exercises, I'm going to combine the two, flexibility exercises as well as balance exercises. Now, doing things like yoga and Tai Chi, which again, I think it's the most underrated sort of flexibility training or balance exercise training. It helps improve your range of motion, your flexibility, your posture. You know how you see, people kind of hunched over all the time. As we get older, we get that kind of like hunched look. Now, doing any sort of flexibility training will help contain that posturing, so you don't develop that actually. It also reduces your risk of having falls. Now, balance exercises using things such as like a balance board. I don't know if anybody here has done physical therapy, but they'll put you on this lovely little balance board and they'll tell you to try to hold yourself up. It builds your core and it helps kind of help prevent yourself from having falls in the future and creates the stability in your body. Brooke, we can go to the next slide. Now, this is pretty much my last slide, and I want to show you some sort of recommendation that we've seen in our literature so that you guys can utilize this in the future. Now, it is recommended to aim for at least 150 minutes of some sort of moderate exercises in a week. I'm not saying a day, I'm saying an entire week. So some brisk walking routine, some sort of cycling, and I would start with just 10 minutes a day and then build on that. So if you've really not, you're like a beginner, or you've really not done this for a while, you've fallen off the wagon some way, and now you want to get back on it, start with just 10 minutes and then build up to another 10 minutes and then build up from there to another 10 minutes. Engaging in some sort of strength training exercising 2 days a week will be crucial to help maintain bone density. Start with light weights or just your body weight. Now, there are resistant bands that you can buy on Amazon. They're all different colors and they go up in all different sorts of variations. And start with the lightest one. And there are routines that you can kind of go online and look at. If you want particular sort of guidelines, I can definitely share with you guys, maybe through Brooke or whoever. It's just some sort of routines that you guys can start with to increase your strength training. You can only imagine the number of people that come to my office and they say, Doc, I walk every day for an hour, but I don't understand. My bone density is still low, or, I'm having, issues with, knee pain or hip pain. And the first thing I ask is, how much, strength training are you doing? And how much stretching are you doing? And, working sometimes with a qualified professional, going to a physical therapist, going to a trainer just for a few sessions is critical also to learn how to actually learn to exercise, and then using those tools and putting them and incorporating them in your daily routine. So overall, as a doctor, as a colleague, as a friend in Iceland, I can encourage all of you guys to prioritize in your daily routines, to put some sort of exercise, cardiovascular strength training, or even stretching to promote and improve your longevity as well as your aging. Thank you. That's all I got.
You did just have some examples as well, which I know you
Yes.
really kind of covered. So thank you so much, Dr. Hushmendy. I'll save my comments for shortly, but so before we get to our Q&A session, we do just have some tips and laws for walking safely. Obviously, walking is one of those forms of exercise and a lifestyle choice that's a good way to combat chronic diseases. As you may know, pedestrian injury and fatality is especially prevalent here on Long Island. So we just want to provide these tips that you can utilize when you're walking safely and getting your steps in. So always use the sidewalk. If there's no sidewalk, always walk facing traffic. That's actually a New York State law. See and be seen, wear brightly colored clothing, carry a flashlight when you're walking at night, cross streets at corners or in crosswalks whenever you can. Don't text or talk on your cell phone while walking. It can be just as dangerous and distracting as doing that while you're driving. And for more information, you can visit walksafeli.org. And now we will take any questions you might have for Dr. Hushmendy. You can feel free to unmute yourself or put your question in the chat, whatever you'd prefer.
Do you recommend any vitamins?
As a orthopedist, I would say I definitely recommend vitamin D, which is something that we lack dramatically in the Northeast, as well as having some sort of calcium in your diet. I don't think a lot of people after our youth, we typically just do not drink enough milk to obtain our lovely calcium. So taking 800 units of some sort of calcium vitamin, as well as taking about, they say about 1,000 up to 5,000 units of vitamin D will help with your bone density. People, just for your cardiovascular health, your neurological health, people talk about taking vitamin B6 or vitamin B12. Any sort of multivitamin composes all of those things. I do think taking those vitamins are critical.
Thank you.
I have a question in the chat. Do you recommend Pilates for stretching and flexibility or any other benefit?
So Pilates is very good. I think that Pilates it's got a more cardiovascular routine to it than actual stretching routine, at least I've not done a lot of Pilates myself, I can tell you that. But I do think that from what I've seen, it does have a lovely cardiovascular component to a little bit of a stretching yoga component to it. So I do recommend that. But doing a isolated stretching routine, I think, is very critical. I'm a hypocrite. I can tell you that I don't stretch enough. So, taking 5 or 10 minutes a day and trying to find that time to really stretch your lower and upper body, alongside with things like Pilates is even better.
I see Stephen has his hand raised.
Oh, yes. Before COVID came along, I was going to the gym 7 days a week, and I had a free membership through my Medicare plan, and everything was going great. And then when COVID came, I stopped going, and I haven't been back. And I just wonder if it's safe for me to go back. I think I'm going to find it very difficult to do aerobic exercise. I was doing the stationary bicycle. I think I'm going to find it difficult to doing that with a mask on. And I just wondered what thought you might have about that.
So, Stephen, I do agree with you. I think that, COVID has been a big negative in everybody's part of their lives, whether it's mental health or physical health. It is a very individualized answer that I can give you. But it's a little tricky for me to answer that. I do think that, from the healthcare perspective, in general, COVID is now become like a component like the flu, at least in our minds now, like it was before. Less people are having it. It's going around less. I think it's becoming a lot safer. Like, I think we dropped our mask mandate actually in the hospital. We're actually not testing anybody anymore in Mount Sinai. With gyms being very crowded, like I just got a note there, you can definitely think about, going at times where it's less crowded. I do think some gym memberships have 24-hour care. I think Planet Fitness sometimes has that, and you can go at hours where nobody's going to be there, which again can mess around with your sleep routine. Besides that, maybe a different aerobic exercise that you can do outside, like maybe getting any sort of bike and actually riding around while this weather is actually pretty good is also a good source. Going around like Jones Beach and had a nice little bike ride, I think, or even in your area, will compensate for that lack, then instead of just going to a gym where you feel uncomfortable. Does that kind of answer your question, Stephen? Or do you want me to elaborate a little bit more?
Well, it does sort of answer my question, and I have been doing walking exercises in the morning in the park. But I still feel that, I miss that stationary bicycle. I was really getting in good shape with that.
I don't know. Do you know which gym you were going to, Stephen? Do you mind me asking?
Yeah, I was going to let's see, what's it called? The New York Sports Club.
Okay.
It's here in the city. And unfortunately they closed that branch, but I still have free memberships available to several different gyms through my Medicare plan.
I would do a quick, a quick little search for yourself. I would go in, I would try to see which gyms are suitable for your liking, whether it comes to, the crowd or your timing. And then, like Meryl has posted on there, I think you can figure out a timing that might be more comfortable for you to go to. I do think that's a huge help if you wanted that gym environment to go on the stationary bike. I know also if you go online, sometimes on eBay, sometimes even on Amazon, you can find a relatively affordable recumbent bike that you can even get at home, and you can watch, while watching TV or watching a show. And maybe these are good little compromises that will hopefully even protect yourself and make you feel comfortable while you're in your own environment.
Okay, thank you.
Great advice. Really, thank you, Doctor. Are there any more questions? So if you do have any more questions, please feel free to put them in the chat or unmute yourself. In the meantime, we do just have some post-event poll questions for you to answer, very similar to the pre-event poll questions. If you wouldn't mind just giving us some additional feedback before you head out today. And I just want to say, Dr. Hushmendy, it's really, that was so insightful and really encouraging to know that, it's something is better than nothing. Starting with 10 minutes a day is, doable, and you can work from there. So just thank you so much for all of your insight and your time while you were in Iceland. Thank you so much for joining us. I can't thank you enough.
Not at all. Thank you, Brooke, and thank you, Ronnie, for setting everything up. And thank you, everyone.
This was so great. Enjoy your time there.
Yes.
Lots and lots of pictures. People love it.
Will do. Take care, guys. Thank you again.
Yes. And thank you, everyone in attendance.
Thank you, Brooke.
Thank you. And thank you to everyone answering the poll questions. I'll leave these up for maybe 20, 30 more seconds, and then we'll close out here. Okay. Oh, it actually looks like everyone answered. So thank you all so much. And everyone have a great, great afternoon.
Bye-bye.
Bye-bye.